Okay, I'm going to start this sequence again. We're doing a pre-manipulative procedure for the SC joint. This is to determine tightness in the SC joint, and also will become therapeutic if we choose to use it therapeutically. So we'll lift the arm up, which creates a space underneath the proximal end of the clavicle, right near the SC joint. And if we lift the arm up, we can get our digits in there. Notice the headpiece is relatively straight, so the cervical spine is not flexed. Once I get my digits in there, 2, 3 digits, second, third, and or fourth digit, I let the arm come down, and then I horizontally abduct, feeling for any significant pinching of my digits that occurs before 90 degrees. I'm starting to get pinched good at 90 degrees, which is what you'd expect to find. That's the diagnostic part of it. Any significant pinching before 90 degrees of horizontal abduction. The therapeutic part of this is if my patient will tolerate this, I can use this stretch to push the clavicle forward and stretch the SC joint. So it's going to give me a therapeutic stretch. The way I'll do this is I'll lift, and as I bring this down, I lift up with those digits. So I'm lifting up with those digits. When I was doing it diagnostically, I was just leaving them there, keeping them inside that space that I created. But now therapeutically, I'm actually lifting up the clavicle as you can see me lifting his shoulder up as I'm bringing that down. That's the therapeutic part of it. Now, he didn't make a face, but that can be a little uncomfortable because it tends to be a tender area, so you do want to be aware that that can be a tender procedure, and if it's too tender, you're not going to be able to do much with it therapeutically, at least. All right? So let's break out and practice that diagnostic and therapeutic procedure.